Welcome back, my friends, and welcome to part 2 of anxiety, phobias, and panic. I don't exactly know that that's what I'm going to call this, but for now, yeah, that doesn't sound like a bad name. Anyway, so I left you with being in the doctor's office and him wanting to prescribe me some kind of a psych med. I don't know, and I was just totally against it. You know, I've never been one of those people that like to take pills. I mean, although, unfortunately, I've got to take all kinds of stuff now, but I've never been one of those people that really liked taking pills. Even aspirin. I just don't like taking that stuff. Although, like I said, I take an aspirin every day now. I take vitamin E, I take, fish oil, I take all kinds of stuff now. Vitamin D, blah, blah, blah. But as far as medications that was going to alter the chemistry of my brain, I just wasn't really cool with it, to be honest with you. And I said to him, I go, there's got to be some kind of physical problem. And to be honest with you, I mean, I'm thinking, God, feeling the way I felt, I was thinking, God, do I got cancer? There were plenty of people in my family that died at my age or younger from cancer, and I was thinking, damn, what the hell's killing me? And in fact, to humor the doctor, said, well, write me the script. I never even had it filled, but he wrote me the script for whatever the hell it was. And I had an appointment with my cardiologist. Because remember, I previously had a heart attack. So I went to my cardiologist and I told him, I said, look, I sometimes I can't breathe. I feel this tightness in my chest. And, I've already had a heart attack. And he's like, well, I think we should probably do a cath. And I told him, I said, by the way, I'd already had a cath previous to that. So this would have been my second cath. And as most of you know by now, I've had 3 caths. But at that time, he said, I want to do a cath. He goes, make sure that everything's okay, blah, blah, blah. You have a history of a blockage, blah, blah, blah. And then I told him about the panic and stuff and that my primary care physician wanted to prescribe me with, I think it was Lexapro. Anyway, he said to me, I'll never forget he said this, he goes, listen, he goes, I have a lot of patients that are on some kind of medication for everything from depression to panic or whatever. And he said, my advice to you, he goes, and you're probably not going to hear this from any other doctor, he goes, but my advice to you is whatever it is that you have eating you, he goes, try to figure out how to either fix it or deal with it without taking any of those medications. He said, because a lot of my patients that are on those things, whether it's Prozac or Buspar or Lexapro, he goes, they can't get off of them, and they want off of them. And he said, he goes, it's one of those things that once you start down that road, you're on that road. And I said, well, I appreciate that. And I felt the same way anyway. It was just nice to hear an MD actually say the same things that I was thinking. And like I said, I still at that particular point, I personally, even though the doctors didn't seem to be, I was personally convinced that it was a physical issue. So I go down this road further, and my primary care physician is I've got this guy running every test known to mankind, except for the one that probably would have changed everything for me. I'll never forget this because I was playing Google Physician. I had ruled out a few things. Now, I remember my mother had a gallbladder surgery when I was a kid, and I remember asking her, I'm like, Mom, what were your symptoms? And she told me what her symptoms were, and I didn't have any of those. So I automatically had, in my mind, ruled out gallbladder. So I go to my primary care physicians yet again. At that point, it seemed like I was going there every couple of weeks, and we're going over the latest round of tests, and he said, I'd like to take a look at your gallbladder. I said, Doc, let's not waste any time on things like that because that's not it. So I had done diagnosed myself, or not diagnosed, but ruled that one out. So he didn't run any tests on the gallbladder. And that's where I have to tell everybody that's watching this video, do not try to self-diagnose yourself. I mean, there's nothing wrong with doing a little research into different things, but don't rule things out. Just don't, okay? Because I did, and I screwed myself. I really did. So let me get to that point. Anyway, so my life seemingly at that point is kind of becoming unglued. It got to the point where I was starting to suffer from agoraphobia. I guess I have some phobias, but it got to the point where I only felt comfortable in my house. And even then I didn't feel that comfortable, but to go out to even drive became torturous. It literally became torture to drive. I remember I had to drive my doctor's office, and I remember being behind the wheel of the car and coming up to a red light. And from my house to the doctor's office, there's just one light. And I can remember staying in the right lane because I didn't want to feel boxed in or closed in or trapped. I was in the right lane, and I had, I was always looking for an exit, okay? So I'm coming up this red light. I got to leave enough room just in case I have to, go over the curb. I mean, it was freaking horrible. I'll give you another one. I go to get my hair cut. I get into the chair, and all I could think of was having a panic attack halfway through it. So I sit down. She puts the thing on me, the apron, and I go, I got to go. And I take this thing off that she just put on me, and I jumped out of the freaking barber's chair and left. That's how freaking crazy it was. YouTube's the only thing that really kept me sane because it was a way that I could connect with people. Meanwhile, I'm still in charge with this crap in Kentucky, trying to get everything there coordinated and dealing with Mike Smith and Target Oil and Gas. And by that point, there were some issues coming up there, and it just, well, yeah. And in fact, to be honest with you, a lot of people have asked me why I hate Mike Smith so much. When I got that check, the first check was awesome. Second check was awesome. The third check, everything started falling apart. And I remember hearing him say, well, we must have just hit a gas pocket, which ended up being absolute fucking bullshit, which is why he's in prison. But it was just like the wind got knocked out of me. It was just, the whole thing was just absolutely horrible. Absolutely horrible. I went through so much agony. The whole panic thing, I never left the house. I remember going to meet my friend Mike and my friend Kim at a restaurant, and I got halfway through my meal, and I looked at them and go, I'm sorry, I got to go. All the people, everybody talking, everything seemed so amplified, and it was just, okay. Let me fast forward this because I'm at 7 minutes now. Let me fast forward this. I dealt with a lot of the horriblest parts of panic attacks and anxiety and phobias and all that stuff, and I felt like my life was spiraling out of control, and and you wouldn't know this by watching my YouTube videos, by the way. But a lot of this stuff was going on during the meat of the heart in the middle of my YouTubing, and I think that I used YouTube as a way to still connect with people because I had shut myself in and away from everybody. And without YouTube, I don't know. To be honest with you, I'm not sure that I wouldn't have just offed myself. I mean, it was getting that bad. So then, fast forward to the day where I go to the hospital because I'm having this pain, which turned out to be my gallbladder. Okay. So, long story short, okay, I get my gallbladder yanked out. Now, I was in the hospital for a week because my gallbladder was such a mess. In fact, I remember my surgeon told me, he said, you're lucky to be alive. I was there for a week with morphine, so I don't really count that, but I can remember when I first got out of the hospital and was off of the pain medication, the first thing I thought of was, I don't have any anxiety. My anxiety is completely gone. Everything's back to the way it was before. I mean, literally been going through this for a couple of years. And I can think to myself, what the hell? So I remember I had an appointment with my surgeon, and I said to him, I told him the whole story about all the anxieties and all this stuff, and I said, now it's gone. It's like it's just somebody flipped a switch. I said, do you think it had anything to do with the gallbladder? And you know what he told me? He said, your gallbladder was so bad, he goes, it was poisoning you. And he said, your body was doing what's called going through what was called the fight or flight response. He said, your body knew that you were under attack and that something was very wrong and deadly to you. And he said you were panicking because of it. It was kind of like there was nothing to fight against because it was like you were shadow boxing. And he said that was probably the cause of all your anxiety and all of your panic and all of that stuff. True story. So, had I only let my doctor, follow his reasoning for checking out my gallbladder, I probably would have saved myself a very long time of agony. So, the moral of this story is that if you're suffering from panic and if you're suffering from anxieties and all that stuff, think about this. It could seriously be something internal. And I'm not saying that to freak you out. Just saying that because before you start getting on any kind of psych meds. Anyway, here I am at almost 10 minutes. I got to let you go. I like to keep these under 10 minutes. So I shall see. If anybody's got any questions, let me know. Bye.